Good afternoon, everyone, and thank you for inviting me to participate today and discuss the role that the extractive industries can play in improving community health. I'd like to begin by acknowledging the Wurundjeri people, who are the traditional custodians of this land, and pay my respects to their elders, both past and present. And on behalf of BHP Billiton, before continuing, I wish to extend our condolences to all who have lost friends, families and colleagues in the tragedy of flight MH17. We will forever be thankful for their commitment and contributions to improving the health of others. As I said, I'm here to speak on behalf of BHP Billiton. Those familiar with us may know that we are Australia's largest company. We are also the world's largest diversified resource company, with a truly global presence of 141 locations in 26 countries. This presence means that we operate in dozens of communities, each of them unique. As a company, we place a great deal of emphasis on supporting all of the communities we operate in. We're proud when we can make a positive and sustainable contribution to people in these communities and when they value our relationship with them. One of the ways we can contribute is through funding programs to improve community health. The rationale is simple. Our experience tells us that healthy communities are productive communities and happy communities. A community that's grappling disease or is without adequate medical facilities and personnel will simply not be able to achieve their potential. But it also makes business sense. If our workers or the workers in our supply chain are battling high rates of chronic disease, then we will not be able to achieve our business objectives. One of the really significant benefits that BHP Billiton can offer a community is employment, both at our operations and through targeted community training programs. But if a community is hampered by illness and its citizens are not well enough to work or attend training or need to be caring for sick family members, much of that benefit is lost. Worse still is the possibility that some of its citizens will not even reach working age due to sickness and disease. This is the situation confronting operations in Mozambique. There, more children die from malaria than any other disease, and it's the second highest cause of life lost from premature death after HIV/AIDS. HIV/AIDS, as well as being the leading cause of premature death in Mozambique, has additional medical and social complications, particularly for children, infants and mothers. In Mozambique, BHP Billiton operates an aluminium smelter called Mosel. It's one of the largest aluminium producers in that country and a major source of community income. But without action to stop the spread of malaria and improve community health more broadly, including on HIV/AIDS, any economic benefit we can offer is diminished. There are two primary ways that we are helping to address health challenges in Mozambique: locally, through our assets and operations, and globally through our corporate charities. These charities are independent and designed to support large, long-term projects with a geographic footprint that extends beyond our individual operations. Through one of our charities, BHP Billiton Sustainable Communities, we sought out a partner who had the size, influence and expertise to make a real tangible contribution to the challenge of malaria in Mozambique. And so we began a partnership with the Global Fund. As many of you will know, the Global Fund works to forge partnerships between governments, the private sector and communities. In doing so, it is able to make contributions and resources and execute a coordinated effort to tackle disease. Last year, we pledged $10 million to the Global Fund because we believe that contribution, the combination of its scope, expertise and large pool of donations means it will be able to achieve particularly effective outcomes in support of achieving the government's national malaria strategy. BHP Billiton Sustainable Communities is also addressing broader health challenges in Southern Africa through the Window of Opportunities project. Rather than focusing on a single health issue, this project takes an innovative, integrated approach to regional health challenges. It is implemented by PATH, a US-based organisation with a country presence in Southern Africa. Window of Opportunity is a 5-year initiative that commenced in August 2011 and has a total budget of $25 million. It focuses on improving the health and development of children up to the age of 2 by combining maternal and child health programs with early childhood development interventions in South Africa and Mozambique. The project recognises that pregnancy and early childhood represent a critical window of opportunity to improve health outcomes and shape children's long-term physical, cognitive, social and emotional development. From the beginning, program workers engaged in broad-ranging community dialogues and feedback sessions to better understand the burning issues in maternal and child health, as well as locally responsive solutions. The challenges they identified included gaps in health workers' capacity, staff shortages, inconsistencies of data management, social stigmas, and behavioural problems. Since then, the program's worked strategically with governments at national, provincial and district levels, community-based organisations, development partners and academic institutions to devise and implement sustainable solutions. Much of the work to date is through training and system strengthening. At the end of 2013, the project had trained over 300 health professionals on essential maternal and health skills, provided ongoing mentoring for over 265 health personnel, and provided technical support in service quality improvement to 85 health facilities. Communities are reporting greater use of antenatal care and adherence to treatment regimes for HIV/AIDS, including for the prevention of mother-to-child transmission of HIV, and in some districts, the proportion of HIV-exposed babies tested for HIV antibodies has more than doubled. The project continues to provide practical, sustainable contributions to community health, and we are proud to be able to support its achievements. I said earlier that our approach combines the reach of our corporate charities with direct action from our assets and businesses. So in addition to the charities partnership with PATH and the Global Fund, we have adopted targeted health programs implemented by our local operations in Moselle. In areas where there is a high prevalence of HIV/AIDS, malaria and tuberculosis, BHP Billiton supports community health programs overseen by our assets and our businesses. These cover education, training, voluntary testing, counselling, screening and treatment programs. As part of this, we also offer prevention and risk control programs to employees and to our host communities. So in concluding, we firmly believe that where the ability of our communities to fulfil their potential is being significantly impeded by the presence of serious disease and poor health, then the investment in sustainable health programs is one of the very important ways that BHP Billiton can positively contribute in a lasting way to those communities. Our experience is that there is rarely a one-size-fits-all approach that will effectively address health challenges in the communities where we operate. Our company approach is founded on flexibility and collaboration, which I believe is evident in the way we are working with the challenges of malaria and HIV/AIDS in Mozambique. In sharing our ideas and experiences, we will surely be better equipped to achieve the positive community health outcomes we are all in support of. I look forward to the opportunity to hear and learn from my colleagues on the panel and welcome questions from other participants here today. Thank you.